A common question I get is, I want to have an explant operation, but I want to have more children. So, should I have the explant operation first? Should I have the kids first? What should my timeline be for that? So, I tell patients it really is a personal choice for the patient. So, obviously, if you still have the implant and you get pregnant and you decide to breastfeed, things like that, the breasts get even larger with an implant in there. So a lot of people feel like they want to do the explant first so that they can go through the pregnancy without worrying about the extra weight and extra fullness of the implant. Makes a lot of sense. Some people say, well, I know my breasts are going to change afterwards, so maybe I want to get all my operations, my breast lift, things like that done after I'm done having my kids, which makes a lot of sense too. So realistically, I ask patients, when are we thinking about getting pregnant? If we're thinking about getting pregnant in the next year or so, you can definitely do the explant operation, but I would probably wait on doing any type of lift until you're done with all the pregnancies, done breastfeeding, because obviously the breast will change. You'll get engorged with milk, you'll get a lot of stretching. If you do a lift first, you may need another lift after you're done with kids. In addition, in theory, anytime you go around the nipple, you may be diminishing the ability to breastfeed slightly for some patients. There are plenty of patients that can breastfeed just fine after doing a lift, but it's just hard to know exactly. Wouldn't be able to make those promises for people. So if someone's going to have their child in the next year, fine to take the implant out, do the explant operation, but I would wait on any type of lift. If someone said, you know what, I may or may not have kids, this may be a 5 or 6 year down the line thing, then I think it's totally reasonable to do the lift at the same time if that's what they want. Now, the next question I get is, well, when can I actually get pregnant after my explant operation? Do I need to wait a certain amount of time or something like that? And the answer is no. So from my standpoint, whenever you actually get pregnant after the operation, you're going to be far enough from the operation. I'm not worried that you're going to affect your wound healing or get any type of complication or anything like that. So you get pregnant pretty much whenever you like to. You wait a couple weeks, and then if you wanted to try after your explant operation, you certainly could. But it can be done anytime before or after your pregnancy, and there's not a certain amount of time that you have to wait. It's just if you're thinking about having a lift, I'd probably wait if you were planning to have a child relatively soon after your explant.